Hello, I'm Marie Walton-Mahon, the founder of Progressing Ballet Technique. I would like to introduce you to Weronika Tobolska. Point work commences early in a student's training, as Weronika has identified. This is why PBT has dedicated a new section devoted solely to pre-point and point training. And chape, hold, equal turnout, good girl, and change, and releve, cross. What are the main foot injuries that you treat in adolescent students?
Oh, foot and ankle injuries are by far the most common injuries in adolescent dancers and the majority of clients that I work with. And the most common ones I see are related to point work. And these are posterior ankle pain, which could be impingement, it could be Achilles issues, flexor hallucis longus tendinopathy, but also midfoot injuries, like cuboid syndrome that could happen following after unresolved old ankle injury, ankle sprain. So, and in subjective history, I usually hear from dancers that they had started point work a year before and their symptoms developed just a few months later. And they kept on dancing with all the little niggles, ignoring them initially, and then before they would come to see me. And very commonly, those dancers have not had any point assessment done or any conditioning.
I couldn't agree more. How important do you feel pre-point testing with a physiotherapist is? And what are the indicators you use?
Oh, it's extremely important, Marie. Pre-point assessment ensures dancers' safety by checking their readiness for point work. And it is a big part of injury prevention, which is absolutely crucial for the young bodies. The way a dancer should look at the assessment is that it is not a judgment. It's not either or scenario, whether you are a good or bad dancer. It's more of a roadmap with indicators and pointers of how to get to the point work safely. And the assessment is very comprehensive. It takes about 1 hour and we look at many different things. So we take measurements of range of movement, we check functional skills because these are being shown by studies that they're the best predictors of point readiness. So we check ankle, hip, and knee alignment and control. We look at technique placement and muscle recruitment, and we look at muscle strength as well, whether their technique and position is supported by their own muscle strength. And calf strength here is the really big factor. It's really important in preventing injuries, so dancers need to have really good calf strength.